reacting today to one of the weirder ways of doing lip filler. Let's have a look. So this is the Russian strip lips. Yeah, cool. So you can see here they've got some tape. So this is like Steri-Strip. This is the same thing we use if you come into emergency and you got a little wound, and we can just tape that up. They've done it here for the purposes of reducing the spread of lip filler that goes from the pink part of the lip to the skin part of the lip. So you can see these are really plump, large lips. Some people really like to go for this look. It's not for everybody, I understand that. But one comment I'll make about this, even though they've done all the taping here, this girl, she probably had big lips to start with. And a lot of lip filler getting to that real big look, if you've got paper thin lips to start with, you're never getting there, regardless of what we do. We can put as much tape on as we want. We're never getting your lips safely to that volume. So it's all about what your baseline is and what is realistically achievable. So this is a different way of doing lip filler. Does it work? I don't know. I don't think there's been any evidence or studies or anything to prove it works or it doesn't work. But let's have a look at the actual anatomy and see what they're trying to achieve anatomically and physiologically. Let's have a look at the lip anatomy and explain what's happening here. So this is the lip. So this is the cross-sectional anatomy. If you cut it in half and had a look inside, this is what you would see. This is the lip muscle itself. It runs up almost the entire length of the lip here. You have, this is where the hair of the lip is. So for me, this is my mustache area. This is where the lip becomes pink and dry. And then this here is where the lip becomes wet. Okay, so you get that wet, dry border. You can see here there's some labial glands, so you can see them when you actually turn your lip inside out. You'll see those little, that's what the little bumps are, those glands. And then you've got the labial artery. So this is where the blood supplies to the lip. And if we want to avoid that at all costs when we do our lip filler injection. So you can see the lip filler is going to go somewhere in here. So it'll go a little bit in the muscle, a little bit in the mucosa itself. And with the taping, where they've put the tape is around here. And the purpose of that tape is to prevent the filler from coming down this way. But you can see here, there's no clear anatomical delineations or connective tissue that's going to stop the lip filler from traveling. So putting that tape on there is going to be pretty limited in terms of how much filler it can stop going down further. So does this work? I'm not sure. There's not too many studies around it, but from an anatomical perspective and physiological basis, I don't know how effective it would be.